Lithium was the first medication discovered to effectively treat bipolar mania, and for decades it was considered the gold standard for treating bipolar disorder. But today, only about 15% of people with bipolar disorder in the United States take lithium. So what changed, and is it still the best option? I take lithium myself, and for me, it truly is a wonder drug. But its use in psychiatry has declined over the years, even though it's still considered one of the most effective medications for managing bipolar disorder. If you've been prescribed lithium, you may be wondering why more people don't take it, why many doctors still recommend it, and what to expect. I'm Patty, the girl with blue energy. I have bipolar disorder and I make videos about mental health and personal growth. The type of lithium used to treat bipolar disorder is called lithium carbonate, and it's derived from lithium, which is a naturally occurring mineral. We don't know exactly how lithium works, but we do know that it affects how nerve cells communicate with each other. Let me explain. Nerve cells communicate by sending signals that tell them when to fire. Sodium and potassium play a big role in this process. Researchers think people with bipolar disorder may have higher levels of sodium inside their nerve cells, which can make them more excited. Because lithium has similar chemical properties to sodium, it can enter nerve cells through similar pathways and interfere with how sodium is handled inside the cell. This may help lower overactivity in nerve cells and reduce excitability. Lithium also affects the release and reuptake of neurotransmitters like dopamine, GABA, and glutamate, which may help reduce excitatory effects or increase inhibitory effects. This is why it's considered a mood stabilizer, because it basically cuts down on the extreme neurotransmitter signaling that you see in bipolar brains. Lithium affects other signaling pathways in the brain, but we have a lot to talk about, so I'm not going to get into every mechanism. There is another important thing to note about lithium. We believe that it has neuroprotective properties, which means it protects your brain cells. We know that untreated bipolar disorder leads to a loss of gray matter in the brain. So these neuroprotective properties are significant for people who have bipolar disorder. What does lithium help with? Let me start by reminding you guys that I am not a doctor. This is just general information about lithium. Please consult your doctor about any specific questions you have about lithium or any other medications you take. Lithium is used for both bipolar 1 and bipolar 2, but it works best for people who have classic symptoms. So you have hypomanic or manic episodes and depression episodes. If you have mixed episodes or other things going on, lithium might not be the medication for you. Your doctor may prescribe another mood stabilizer like Depakote or some other combination of medications. Lithium is used as an anti-manic. It can be used for both acute mania, so they may give it to you if you're in the hospital and your manic episode needs to be brought down, but it's also used for recurrent episodes of mania. It helps with both manic episodes and depression episodes, but it may help more with the manic episodes. And if you're having a lot of problems with depression, you may need an additional medication to go with the lithium. Lithium also reduces your risk of suicide, which is really important if you have bipolar disorder. And this has been documented through numerous studies and clinical trials. Now that you know a little bit more about how lithium works and what it helps with, let's talk about the history of lithium, which I find really interesting. A Swedish chemist discovered lithium in 1817, but it wasn't until the 1940s that lithium found its place in history as one of the first psychiatric medications. Australian psychiatrist John Cade discovered the calming effects of lithium when he was conducting experiments on his patients' urine. He believed that people who had bipolar disorder made some type of chemical that made them manic. So if their body made too much of this chemical, it would make them manic, and too little would make them depressed. He believed this substance would be excreted in their urine. So to test his theory, he collected urine samples from his patients. Some of them were manic, some of them were depressed, some of them were schizophrenic, and some of them were healthy patients. And he took their urine samples and injected them into guinea pigs. And interestingly, the manic samples were the most toxic. So he tried to isolate which compound in the urine was responsible for this. In order to do this, he needed a way to dissolve certain components of urine in water. So he used lithium salts to dissolve these components, and then he injected it into the guinea pigs. When he injected this mixture into the guinea pigs, it had a calming effect. That's when he started to realize that it might be the lithium that was making the guinea pigs calmer. After some experimenting, Cade eventually gave the lithium to patients, and that was the history of when we first started using lithium for bipolar mania. Why has lithium fallen out of favor? Lithium was approved for the treatment of bipolar disorder in the US in 1970, and for decades it was considered the gold standard and the first-line treatment for bipolar disorder. Now that there are a lot more medications available, the use of lithium has gone down. And there are some good reasons for that. The main reason is not because other meds are more effective. It's because lithium requires a lot more monitoring and it comes with a lot of side effects and risks. There are more medications now that don't come with these side effects and risks, so many doctors choose not to prescribe lithium because of this. When I was researching this, I found some studies that discuss the reasons why some doctors choose not to prescribe lithium, and one of the reasons was because of the patient's view of taking lithium. Lithium has quite a stigma and negative beliefs about it, and some doctors choose to not prescribe lithium because the patient has a bad view of it and instead opts for a different medication that the patients may be more likely to take or they may be less scared to take. Some people believe lithium is a last resort medication, like the last medication they'll give you if nothing else works. While it's true that it's not always used as a first-line medication like it used to be, it's definitely not a last resort. It's sometimes doctor preference or what your symptoms look like, but it's not a last resort medication. There's plenty of people who still take lithium. What can you expect if you've been prescribed lithium? Here's a few things you should know. Before you start taking lithium, make sure you have a conversation with your doctor about any health conditions you have, like heart issues or breathing problems or kidney issues. And if you're breastfeeding or pregnant or thinking about getting pregnant, definitely talk to your doctor about that. And also, if you follow the ketogenic diet like I do, make sure you let your doctor know that. When you take lithium, your blood levels need to stay within a therapeutic range. So if your levels are too high, this will lead to lithium toxicity, but if they're too low, you may not see the therapeutic benefits of taking lithium. So when they first start you on lithium, you may have your blood drawn frequently every week or two, but once you're on a maintenance dose and it's stable, you'll probably be checked every 3 months to see what your blood levels look like. Your doctor will also routinely monitor your thyroid and your kidney function. What can you expect if you take lithium? A lot of people think lithium is like some heavy-duty tranquilizer, like it's gonna zombie you out. And that's not at all what lithium feels like. It usually just makes you feel basically whatever your baseline is when you're not manic or depressed. It makes you feel like yourself again. Now let's talk about lithium's side effects, risks, and precautions. This is not going to be comprehensive, so please consult your doctor with any concerns you have about taking lithium. Some common side effects you might experience, especially when you first start taking lithium, is increased thirst, frequent urination. You might notice a mild hand tremor, or GI issues like you feel nauseous or your stomach is sick. Your lithium levels are affected by your hydration, so make sure you're staying hydrated. Lithium toxicity is possible if your levels get too high, so stay on alert for symptoms of lithium toxicity. Some symptoms you might experience if you have lithium toxicity is muscle jerks or twitching. You might have slurred speech, dizziness, blurred vision, feeling like you're drunk. Those are just some of the symptoms you might experience if you're having lithium toxicity. It's also important to talk to your doctor and any of your doctors about medications you're taking, because lithium can interact with other medications. And your doctor will probably tell you to avoid NSAIDs like Advil or Aleve, because this can affect your lithium levels. Lithium can also affect your thyroid and kidney function over time. This is one of the reasons why you have blood work to check your thyroid and kidneys routinely. I'm going to tell you a little bit about my experience with lithium. The first time I was put on lithium was right after my first manic episode, and I was hospitalized. So they must have given me a pretty heavy dose, because I remember having blurred vision, slurred speech, shaky hands. So they took me off of it pretty quickly. And now that I know what lithium toxicity is, I realize those were lithium toxicity symptoms. After the lithium, I tried several other meds, but they either made me sick or they didn't work. So we eventually went back to the lithium, and this time I started at a lower dose and tapered up. And that's when I found that it worked. What I like about lithium compared to other medications I've taken is that lithium doesn't really affect me. It just basically makes me feel like me at my baseline. I still have some mood swings, but they're more in the realm of normal mood swings. I don't have the hypomania or the mania when I'm on lithium. Another thing I like about taking lithium is it hasn't caused weight gain for me. And it also doesn't make me feel sedated or slowed down. It just makes me feel like me when I'm not manic or depressed. The only thing I don't really like about lithium is that it doesn't really help me that much with depression. I still get depression episodes even while taking the lithium and following the ketogenic diet. And I haven't had very much luck with antidepressants. Almost all of them make me manic, so I tend to avoid them. And instead of trying to find a medicine to take with the lithium, I just try to manage my life so that I don't have as many issues with depression. And a lot of my episodes are situational versus a mood episode. Lithium has been the best medication I've taken for my bipolar disorder. And even though it has risks and precautions, I still think it is the best choice for me. This is my experience with lithium. If you've taken lithium, please feel free to share your experience, good or bad, in the comments. Thanks for watching, guys. If you found this video helpful, please click the like button and, of course, subscribe. I'll see you guys again real soon.